Now, Good Morning Maryland at 9.
And every year, diabetes affects so many Americans out there. Some 25 million men, women, and children are affected by the disease, and it can have so many secondary influences on other bodily organs, as well as your feet, your hands, other extremities. But what about your eye care? Well, coming up this morning, we're going to be joined by a doctor talking about that and how a group of men have come together to try to raise awareness for eye care as it relates to diabetes, raising funds and also educating us, and they're doing it in a quite unusual way. Have you seen people walk around with a little bit of the mustache going and whatnot?
I've heard about it, but I haven't seen it yet.
Well,
That's what that's all about?
The doctor's coming in this morning. He is properly adorned, still in the mustache. He's over there
I do see it.
grinning, so we'll be... What?
Maybe you'll be inspired and you'll grow one yourself. Who knows?
I don't think the management here at WMAR would like that too much.
All right, Mortgage Monday, so we'll hear from Carl Delmont. He's going to answer your questions. You emailed them in, so we'll get them answered.
Time now 9:20. The disease can be devastating, causing numerous spin-off health issues. Coming up, the role diabetes can play on your eyesight. We're going to talk to Dr. Katzen, who's telling us about a fundraising event challenging men to grow the old stash back out. That's next when Good Morning Maryland returns. Welcome back to Good Morning Maryland at 9 o'clock. It is such a serious condition affecting close to 25 million men, women, and children. Diabetes can cause a number of secondary medical problems if not treated correctly. Now this morning we're talking to Dr. Katzen about the disease and what it can play and the role it can play on your eyesight. Now before we get into this interview, Dr. Katzen, we want to clear up something regarding the mustaches and the facial hair, because this was for another event.
Right. There's something called Movember, where awareness for cancer, especially men's cancer, prostate cancer, and men are supposed to wear their Movember for the month of November and grow it in full view. And when we were going to come see a little earlier in the month, I was wearing a very thick mustache that my wife had me nixed.
Got rid of it. It's amazing how the wives can do that, isn't it?
We thinned it out a bit just to make it a little bit more acceptable at home.
Now, getting into how diabetes can affect eyesight, there are so many different ways it can take such a toll on a person, can it?
Right. The diabetes affects the blood vessels of the body, and your eyes have some of the most active blood vessels in the body, and the little vessels get more blood through them than any of the others, so they get damaged first, and it can lead to loss of vision.
Now, in terms of that, we're talking about things like cataracts, glaucoma, ailments like that. What can a person do once they begin to see the early onset of this? And moreover, is there an age range in there? Could a child start to see some of these issues early?
Great question. We've seen kids who come in and they can't see, and their parents finally bring them in and they have cataracts. We get their sugar tested, and lo and behold, they have diabetes, and we've just saved their lives. So if your kids are complaining about blurred vision, or you're noticing your vision's blurred, or you wake up at night to go to the bathroom a ton of times and you're always drinking because it makes you thirsty, those are early signs of diabetes. And when the sugar's high, it causes the lens to swell, which causes visual loss, cataracts, and can cause mess up by the drain of the eye or glaucoma. And then mostly it affects the retina, which does your seeing by affecting those blood vessels, and they leak.
Now, in terms of treatment, how would you go about treating this?
Well, the most important thing is that the patients control their blood sugar by seeing their medical doctor, and they either go on insulin or medicine or control their diet and weight so that they live a healthier lifestyle and don't have diabetes or is effective. And then they should see their eye doctor once a year to check to make sure there's any signs, because there are treatments to help reduce visual loss.
And if you are diagnosed with diabetes, you really need to be much more judicious in how you go about seeing your doctor, those timely visits, making sure everything's going smoothly because of all of the secondary ailments.
Right. So you just want to make sure you have a clean bill of health with your eyes once a year, and then if not, you take the advice of a good doctor and get the treatments necessary to maintain your vision.
Now, if someone has not been tested for diabetes or think there could be something going on there, what are some red flags? What are some telltale signs a person might need to know before scheduling that doctor's appointment, just as a warning sign?
Well, I think the big things that we look for, we ask patients who are complaining of blurred vision that fluctuates, because the sugar will cause your vision to be very blurry and you won't know why, is we like to see if they're really drinking a lot of water, a couple glasses of water by the bed at night, or if they're getting up 3 or 4 times to urinate and go to the bathroom. These are signs that sugar may be out of whack, and you should see your doctor and get your blood tested. And what they'll do is they'll just do a blood test and they can see what your sugar is, and that'll let you know if it's too high.
Dr. Katzen, thanks so much for the time. We'll have this on our website, ABC2News.com. That'll be up a little bit later this morning if you missed any part of this interview. Megan?
All right, thank you very much, Charlie.